Good afternoon, my name is Fernanda Vazquez Sanchez. This is GAC008 assessment event number 2. My student ID is 860019434, and I'm going to talk about people and society, specifically healthcare inequality. So first of all, one time Mr. Martin Luther King said, "Of all the forms of inequality, injustice in healthcare is the most shocking and inhuman." So in my introduction, I want to talk about what I think about this quote, why it is important to share this information with more people so we can eradicate this social problem that we have nowadays in our world. So I think that this is really important to share with a lot of people because nowadays we have a lot of social problems that are really hard to solve because the people are still thinking that they are better or they are more important than others. So in consequence, they don't care about other people, they don't respect, and they think that they are the only ones that only cares in the world. So, and also there's a lot of injustice types, like for example, inequality in gender, like the man is the only one that can work. Inequality on intelligence, that if you don't go to high school or university, you are not gonna be anyone in the future. Nowadays, one of the most richest people in the world, they didn't even go to college. So, and also inequality in healthcare. It's really shocking that we still have these kind of problems because healthcare is the main thing that we have to care about, our health, so we can work, so we can gain money to our family. And in 1960, the richest people get the twice than the poor one. Like they get the twice of one man that maybe they don't get anything, and the richest will get the double of that. Like, what is that? But because of the social programs in 1977, the poor people start gaining 14% more than the richest because they start getting more sick, so they needed more healthcare, more attention in the hospitals. So this is what we have to concentrate, to still supporting social programs, to still helping the ones that don't have a lot and they can gain a lot of sources or a lot of these kind of programs that help you to get food, to get work, to get healthcare, and that's really important to focus on. The causes of healthcare inequality, the principal are the governments that right now, well, nowadays, they are caring more about political stuff like territories or taxes or something like that. Economy, it's going it's going crazy, it's going more high or low, so the prices have to go high or lower. But nowadays they are going more up, so the products are getting more. They are not being so easy to get because they are being so expensive. And also society. We as people still think that if the product is not expensive or they don't look pretty or something like that, they are not good. That if they are kind of accessible to more people, they are like, maybe it's good but not that much. So they go with the expensive. So people that don't have a lot of money, they are like, I don't have a lot of money to get to that better product, and that's really shocking. And nowadays, like 5,000 of children around of 5 years don't pass of that, they die because they don't have access to food, to medicaments, because the prices are getting higher, people are not caring that much in the health, and they're dying. So in my conclusion, I have this quote that says, healthcare is a right, not a privilege. Everybody should have healthcare, everybody should have access to healthcare, and it's not like just a few people can have this product. And that's everything. Do you have any questions?
What is the government doing to eradicate the healthcare inequality?
As I said, well, I didn't say, but the governments are making more social programs, so people can, in different parts of the world or in the countries, mostly in the more like far away places, so they can reach to every people that don't have access to a big city or a little town, so they can have a doctor or a pharmacy. So they are making more social programs to reach those people that don't have the access to medications, food, or any principal product that they need. Another one?
Do you consider that at your country there are these kind of problems?
Right now, I think that everybody in every country has an amount of inequality or healthcare inequality, but my country, I think that it's taking a lot of conscience and worrying about these people that can access to a lot of things. So they are making more social programs so they can reach to these people that can afford a lot of things.
What could you propose as a solution for healthcare inequality?
What?
What could you propose as a solution?
Oh, principally, like, we can help to people can reach to a lot of things, like sharing food, sharing water. Also, we saw children that are sick or they are having some issues with their health. We can call to a doctor or take them to a public hospital so they can have medicine and these things. Well, thank you.